Good morning. Welcome to this presentation to meet the expert titled Get the Most Out of Your Doctor Visits with our expert, Sarah Hart. She's a regulatory and accreditation consultant. Meet the Expert is brought to you by Moffitt Cancer Center, Patients Library and Welcome Center. Please visit moffitt.org, Meet the Expert to see our upcoming sessions. The content in this presentation is not intended to be medical advice, and the viewers should consult their physician if they have any medical questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs. If you think you might be having a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because you watched this presentation. Now, please welcome our expert, Sarah.
Hello, thank you so much. I'm so happy to be here, and I'm glad that you're here to listen to this presentation. And again, my name is Sarah Hart, and I am a regulatory and accreditation consultant. I'm in the Moffitt's Quality and Patient Safety Department, and I've been a nurse for 12 years, all of that being in oncology-related fields. And with Moffitt, I was a primary nurse in the clinic for 6 years. And so I worked with the doctors in the clinics. And so now I'm in this role. And I'm very excited to share with you about Joint Commission's program, Speak Up. And so as a background, kind of explaining how this program of Joint Commission, all hospitals work with CMS, Center for Medicare and Medicaid Services, to make sure we're following the rules, basically. Make sure that the hospitals are following the CMS requirements to be a hospital. And so then Joint Commission is a third party that CMS uses to survey the hospitals and make sure that they are following those rules. There's multiple companies that do that same service. And so Moffitt is surveyed by Joint Commission, and to make sure that we're not only meeting Medicaid CMS requirements, but also exceeding that for patient safety and quality of care. And so Joint Commission, they're due to be here in the hospital in the next couple months. And so we'll be surveyed soon. And so we're gearing up for that. And then in addition to that, coming up in October 16th, our hospital is celebrating Healthcare Quality Week and International Infection Prevention Week. And these are national celebrations that are used to celebrate quality professionals like myself or infection prevention, and just to highlight the things that we're doing to ensure patient safety and high quality of care. So we'll have many activities throughout the hospital that week as well. So Joint Commission has a Speak Up program, and you may see it at various doctors' offices that you go to, where it's flyers that are handed out that kind of list out ways that you, the patient, can speak up for your care and ask the right questions and feel comfortable either advocating for yourself or finding an advocate to help make sure your care is as safe and optimal as possible. So that's what we'll be reviewing today is how to get the most out of your doctor's visit. So this is a kind of a highlight of Speak Up from Joint Commission, and it breaks it down into each of the letters. So Speak Up, speak is the S is the first letter. And so this is just saying, ask the questions. If you don't understand something, say so. This can help you through any doctor's visit. Paying attention, write things down. Different facilities have different requirements regarding recording, and simply ask, may I record this? And they'll walk you through what's needed for that. Educate yourself on your diagnosis or any questions you have, or maybe new medication, or this is the treatment plan for you. Read up on that. Ask the doctor for what's a good resource where I can understand more, or what's a good website that I can go to that's respectable. And then advocates can help. So bring your family members or friends to your visit. Ask for a hospital supplied advocate, anybody that you can get to be part of your treatment and be part of your next steps. And then kind of with educate yourself, know more about your new medication. So anytime you're prescribed something new, learn about it, ask to talk to a pharmacist. They can kind of review how does this new medication uh, revolve around your other medications and interact. And so just learn as much as you can. And then use a quality healthcare organization. And so part of that is you can, and we'll go over all these in more depth as well, but you can ask your doctor, how often have you done this procedure? Or how often does this hospital treat this type of disease? Or how do I know this is a good hospital? jointcommission.org is a public website, and it lists the hospitals that are certified by Joint Commission, and it'll list the services that they're certified to provide. And or you can look up from the state, you can look up how the different certifications or even complaints that individual state has for that hospital. So ask those questions and feel okay doing so. And then participate in all decisions. It's easy to kind of rely on, well, my doctor says this is what I should do, so I should do it. But participate, ask the questions, feel comfortable with the decision as it's happening. So that's the basic overview of Speak Up. And so now we'll kind of get into some of the details. And all of these are pulled directly from the flyers and handouts that Joint Commission has created. So these are kind of frequently asked questions. What should you do to prepare for your doctor's visit? The easiest thing is create a list. Have a list of your medications. Have a list that should include vitamins, herbal supplements, eye drops, maybe even if you're like a boost or insure, any extra things that aren't prescriptions, have those in addition to your list of prescriptions. And then also bring any current health problems that you have, so we know what else is going on in addition to this current problem, and just have that on a list. And then write down any questions you have, anything that you really don't want to forget to ask before you leave. Write those down, because it's easy to forget when you're in the visit. And then while you're in the visit, what do you do if you don't understand? Ask. And that's the theme you'll get throughout this whole presentation, is just ask and be okay with asking more. If you don't understand, maybe they're talking too quickly, or maybe they're using medical terms that you don't understand. That please do ask. And if it's a language barrier, maybe you're not understanding because English isn't your first language, then ask for an interpreter. And they should have interpreters to offer either in person or maybe through an iPad or a telephone. Also, if you're not understanding the doctor's accent, the doctor may have an accent that's just making it difficult for you to understand. That is okay. Ask, maybe a nurse can be in the room with you and can help interpret and can help be part of that discussion so you fully understand the plans. So then can a family member come with you? Yes, please. This got a little tricky during COVID when we weren't allowing extra visitors in the building. But here at Moffitt, we were able to connect through virtual platforms, so that way somebody was in the room with you, whether that was in person or virtually. You can also ask, hey, can I call my family member? They can be on speaker while we're having this meeting, or bring someone with you. Family and friends can be your greatest advocate. So please do bring them with you. And then how can I find if my hospital is a good hospital? We were talking about that a little bit earlier. You can look on Joint Commission's website for are they certified through Joint Commission to be following CMS's rules. You can look on the state's health website, also for any certifications or awards the hospital has received, and on the other end, any complaints that the hospital has received. And then also you can ask the doctor, how often, what's your experience that you've done this procedure, or what extra care can you provide while I'm going through this? And so just ask those questions. And importantly, don't forget and don't be afraid to ask your doctor or your nurse, please wash your hands. They should be washing their hands every time they come into the room and when they leave the room. And it can be with hand sanitizer or with washing their hands in the sink. But it's okay. And if you're worried about addressing the doctor, you can just say, hey, for my benefit, can you please wash your hands again? And then that's not questioning did they do it. It's just you want to see them wash their hands, and that prevents infection, and it's very important. So anytime that you see a caregiver walk in the room, feel comfortable asking for that. So then we'll kind of dig in a little deeper in the same context. When you're talking to a doctor about maybe a procedure coming up or an operation or treatment like medications, they'll talk about it's time to sign this informed consent. And so usually it's on paper and it looks kind of like a contract. But really what you're doing is you're saying, I, the patient, understand the procedure that's about to happen. I understand the risks and the benefits. I understand if I choose not to do this, what could happen. And I understand how to talk to my team throughout treatment. And I understand if I change my mind, what happens. And so it's very important that you talk to your doctor and have your questions answered before you sign. It is signing that informed consent is not a contract. It's not binding you to anything. It's just saying, I promise I understand based on the information I was given, this is the next step. So then similar to that, and I just used that term earlier, the doctor will say procedure. And so procedure is a pretty broad term. It could mean we're going to do a test, or we're going to do a surgery, or we're going to do a scan, or it could even mean I'm going to give this medication to you. So when someone says procedure, if that's not quite making sense in your head, feel comfortable asking. Tell me what you mean by procedure. What's going to happen with this procedure? So then your caregiver, and your caregiver in this sense is referring to your doctor, your nurse, somebody that comes into your hospital room, maybe your home health nurse, some healthcare provider, and if they want to do something that's against your culture or your religion. And so that could be something like you don't want to receive certain blood products, or maybe sometimes a female only wants to be assessed by another female. Please let us know. Let your healthcare providers know this is a thing I want. Speak up for yourself. Let your family members speak up for you. And usually the providers will be able to come up with a good combination that works for you in where you are. So please do speak up. And then what if the doctor or the nurse, if they're rushed because they're running late, or they're rushed because they have an emergency that they had to get to, it's okay. Ask, let's schedule another appointment, or can we do a virtual appointment, or when can I call you to ask more questions? And sometimes the nurse can stick around with you and get a lot of your questions answered. And then if we need to make another appointment to get more questions answered, that's very important. So feel comfortable asking. And then similar to what we already discussed, if you don't understand, ask more. I don't understand because of the accent, that it's just, I'm not hearing. And so let's talk about it again. Let's talk about it slower. The other thing that you can do is here at Moffitt, what we like to use is teach back, where we may explain, we as the nurse or the doctor may explain your upcoming procedure and then say, now tell me 3 things that you remember from what we just discussed. And then by you repeating it, that's helping you remember, but then also telling us, the caregiver, that you understood the plan. And so you can volunteer that. If the doctor says, we're going to do plan A, B, and C, this is what we're going to do, then you can say, okay, let me repeat that. And then you repeat exactly what you understand to be happening. So then the doctor can catch, no, let's revisit this so you understand a little further, or yes, that's perfect. So feel free to repeat what the doctor just said so everybody in the room is on the same page. So then we'll kind of switch gears a little bit to research studies. Moffitt Cancer Center uses a lot of clinical trials and research studies. And a lot of hospitals do, and you may hear from different patients or different doctors, there's so many differences with the clinical trials. So there's a lot of questions to ask, and a lot, I encourage you, ask the questions, write down the answers. So we'll start with you're getting ready for a clinical trial, and it's maybe a new medication. So when clinical trials are doing new medications, they may be testing how safe is it to give, or how safe is this dose to give, or how much dose can I give, or how often can I give this medication. So ask, what's the purpose of this study? What is this study trying to find out? Because then that gives you an understanding of where you fit within that, and then helps guide what symptoms you may be looking out for. And then the other thing is insurance. It's easy to assume, oh, I'm on a clinical trial, they will pay for everything. But don't assume that, because actually not very many clinical trials are able to pay for much. Sometimes clinical trials are comparing current standard of care treatment to a combination of two standard of care treatments. And in that case, insurance may still end up paying for it, whether it's a clinical trial or not. And so ask the research coordinators. The doctors may or may not know, but the research coordinators will know quite a bit. And then also talk to your insurance company, so that way there aren't any surprises. Some clinical trials may pay for a hotel stay, but most of them don't. And so just ask the questions, and then I'll show you this long list. But ask the questions, and so that way you're not surprised. This is a long list that you can kind of refer to, and since this is recorded, you could pause it. But it's basically these are the things that the clinical trial coordinator and the doctor would go over. They would go over, how long does this study last? Is there a placebo? Who pays for care? Those basic things. But it's kind of nice to have this in the back of your mind, or when you get home, maybe go through the list and think, can I answer each of these questions? If you can't, give the team a call, just to make sure that you're totally comfortable with what to expect. And maybe you can write these questions down before you go to the visit, and this can help guide your discussion. These are just examples of questions that might come up. But it's important when you're signing up for a research study to be comfortable with what may occur, and also who to contact. I know here, when clinical trials at Moffitt Cancer Center, you can contact your doctor or your doctor's team and their nurse, or the clinical trial coordinator. And so there's many different teams in it, and so our goal is for it to not be confusing in that case. And so leave that visit with that plan. Who do I contact when I have questions? And then we'll switch gears again to having that discussion with your doctor about a serious illness or palliative care. Anytime a patient is facing the word cancer, that is a scary word, and then the discussions afterwards can be scary. And so it's important just to have those open, upfront conversations with your doctor. And the goal is to do it sooner rather than later, as quickly as or as early in the process as possible. Talking with your doctor about advanced directives, or do you want to be full code status or DNR? And I know there's many other webinars about that here as well. But those sorts of conversations early on and then throughout the process are important to have with your doctor. And then hearing the word palliative care and hearing the word hospice is I was a hospice nurse for quite a while, and it's helpful to hear those phrases and say them more often earlier. So if you need it in the future, it doesn't sting so hard to hear those words. And so with palliative care, you'll hear that phrase. Palliative care is kind of an umbrella term for how can we, the caregivers, help care for you throughout your treatment process, regardless of the goal of treatment, regardless of where you are in the treatment. It's a kind of holistic, all-encompassing way to care for your extra symptoms. So if you're having pain or loss of appetite or needing emotional support, and even for your family, if they need emotional support or help with decision making or care at home or any other maybe financial resources. These are just kind of extra things that make your quality of life better throughout treatment. That's palliative care. So you may get a consult for palliative care while you're inpatient at the hospital to help with pain control, or you may get a consult to the supportive care medicine services here at Moffitt Cancer Center, and that's an outpatient clinic that focuses on palliative care. And so you can be referred to that program at any point from day one to at any point during treatment, after treatment, and their goal is to be there with you and help ensure that your understanding of your quality of life is also focused on. And then you'll hear the term hospice. Hospice is a little piece of palliative care. And so that discussion may come up of what can hospice offer? What are the goals of hospice? And a lot of that is kind of a transition between these cancer treatments may not have a curative intent anymore. So let's focus on your quality of life and what kind of conversations can we have? What questions can we ask together as a team to then make sure that your quality of life is focused on? So this is very important. It's a difficult conversation, and some doctors are hesitant to discuss it because they are focused on curing cancer. And so, but it's important for you to speak up for your quality of life, and pay attention if your family members may also be speaking up for your quality of life, and just be ready to have those open and loving conversations. So we'll kind of wrap this up a little bit. This is kind of a summary, speaking up for your rights. And we'll start with you, the patient. You have the right to make decisions, and you have the right to refuse care and to understand your care. So anytime you're having conversations with your doctor and you don't understand it or it doesn't quite feel right, please ask about it and discuss with your provider, discuss with your family. This is your right to be comfortable with what's going to happen next. You have a right to be listened to and to have an interpreter. You have a right to spiritual services, and you have a right to copies of your test results. And you have a right to privacy, and you have a right to care that is free from discrimination. So just remember that these are your rights, and providers know that. And if you have any questions, please do speak up. So an advocate can help, and this can be your family member or friend. This can be an advocate from the hospital. Moffitt Cancer Center, we have patient care advocates, we have patient experience, we have patient advisors, we have a great team here to help you through the process. And so, and most hospitals do. And so at any point, if you just want that extra support, say, hey, do you have a patient advocate that come talk to me? And they'll be able to get that person to come talk to you. And then be active in your care. And so that, again, ask questions, pay attention and write things down. And if you get home, and because chances are, I always do this, you get home and you think, oh my gosh, I forgot to ask this extra question. Then know how to get a hold of your team so that way you can ask that question. Keep a list of your medications and your supplements and your allergies, and share any wishes that you have with the team. And that this could be cultural or religious beliefs that you'd like to observe, or then any like DNR or living will or advanced directives. Keep those handy anywhere you go. And then again, if anything at any point, something just isn't quite right, or you really want some extra support in, maybe you want to make a decision that disagrees with your doctor, this advocate or patient representative can help those discussions, and they can help you and the team work together to come up with a good plan and a good agreement. You can also report any complaints with state agencies and with the Joint Commission. And these are ways that you can make your concerns heard And then the hospital would work with those agencies to ensure that they are complying with requirements. And so you have rights, and please do speak up. And and the team is here to work with you. But at any point, you can reach out to these other services. Our patient representatives are excellent. So this is, you can see kind of the images for Healthcare Quality Week and Infection Prevention Week that we will be celebrating. And these are the resources that I use to supply this presentation. And I know we're on a recording. If you have any questions, do feel free to reach out. I have my phone number here and my email, sarah.hart@moffitt.org. And any information that I've provided here is available on Joint Commission's website, and as well as Moffitt Cancer Center's website. So thank you so much. Have a wonderful day and stay safe.
Thank you for being in this session. We offer live Meet the Expert session through Zoom. To see a full list of upcoming sessions, please visit moffitt.org, meet the experts, or call 813-745-1690. Thank you.